fifth Director Series webinar. We're very excited to welcome Ellie Dehoney here, our Vice President of Policy and Advocacy from Research America. And this session, like some of our others, will be more of the interview style format where Mr. Khanna will have a discussion with Ellie and we'll take some questions at the end. So as everyone has heard us say this a number of times, the goal of our Director Speaker Series is to hear from healthcare leaders in the industry to discuss the changes that are occurring in the healthcare ecosystem in response to COVID-19 and the long-term impact of this pandemic that will have on our healthcare delivery system. And so for folks who are just meeting Ellie for the first time, she's been a long-term advocate for ARC and has been a real strategic communicator in both the Hill and to other stakeholders. And as we at ARC are always trying to figure out what's the best ways for us to communicate our work to stakeholders, we have a lot to learn from her. So we're really excited to have her. And so as I mentioned, please, we want to hear from you all and feel free to put questions in the chat and I'll help moderate that at the end. And with that, right before I turn it over to Mr. Khanna, I just want to make sure that everybody has seen that we're having a special magic session happening at 12:35 immediately after this session, where you can join Mr. Khanna, Magic, and Orchestrations for a viewing party to debut the special FEVS music video featuring ARC staff. And just please note there's a separate link to get to that. So with that, I will turn it over to Mr. Khanna.
Thank you, Jamie, and good morning and welcome to all of my ARC colleagues. Thank you for joining us this morning. And we have a delightful speaker with us, somebody that I have enormous respect for and admiration for her work. Ellie Dehoney is with Research America and is very familiar with our work here at ARC as well as HHS. She was originally in one of our previous lives in ASPE as well. Is that correct?
That's right. It feels like a previous life. It was a while ago now.
Thank you so much for joining us. As you pointed out, the reason we started this Director Speaker Series was to bring people like yourself from the real world, as I would say, because at times we in government get caught within our own bubble and lose sight of what's happening out there. So we're looking to always learn. Our colleague said, they reached out to me once and said, we've got to get people from outside coming in and talk to us about what changes they are seeing, where the world is going. And Ellie, a lot has happened this year. 2020 will be a year that we'll remember forever. And of course, everybody talks about COVID-19, which is indeed a big disruptor in all our lives. But I want to start asking you a question because you're very familiar with the healthcare sector, various elements of, actually all the elements of healthcare sector. How do you see COVID-19 reshaping our industry?
Sure. Well, the most obvious, I think, would be telemedicine. I think we all encountered that. Suddenly your only option was telemedicine. And I don't think that's going to go away. I think we're going to see a greater emphasis on it with higher reimbursement levels for it to sustain it going forward. So I think that that's one of the biggest changes. And the other is, I think that people are going to be seeing greater anti-infection kind of procedures built into the day-to-day of healthcare for a long time forward, if not, permanently. I think that that's a good thing. And, but I think it'll be more pronounced. So I think those are two that are patient facing that we'll definitely see.
And from a provider perspective, what are you seeing in terms of healthcare systems? How are they responding back? What are you hearing from them?
I think that they're having a rough time figuring out their future because if you have to plan for surges, it's you need more contract workers. So it's going to probably really reshape the healthcare system to provide greater incentives for contractor nurses, contractor physicians, folks who can come in during surges, just for preparation's sake, even, because we just have no idea whether, I hate to say this and don't hate me, but if a pandemic could be followed by a pandemic, we just do not know what the future holds for us or how long the tail of this one, if we're even in the tail, will last. So I think that that's going to be a prominent feature of the provider system going forward. Hopefully it'll bring more diversity with it too, more gender diversity. Contractors, women who can probably handle contractor jobs sometimes easier than they can in full-time work. So I'd love to see that serve some positive goals as well.
What are you hearing from the C-suite, the CEOs in the delivery systems? Because if that is getting totally recalibrated, what kind of changes are you hearing that are happening at the point of care?
Yeah, I'm not as familiar with the delivery system as I am now with the R&D system. But my guess is that they're really thinking about how much facility space they actually need. So when is telemedicine, not feasible? It's not feasible when you're having an MRI, right?
Mm-hmm.
So how do they deal with the amount of capacity they have now for office visits versus what they're going to need going forward and that kind of thing? And again, what do you do if emergency becomes the norm? How do you then do an operational plan? What's your day-to-day if we're in a different environment? I've got to say, my guess is that this pandemic will pass and we won't see another one right away. So one of the challenges for all of us is going to be not to do this kind of thinking that has to do with an emergency and then let it go because the emergency has passed, and then face another one with the same lack of preparedness that the whole system felt this time around.
But we don't expect the system going back to what it was in the past. Enough disruption has been caused by COVID-19 and all the other factors that were at play. So as you mentioned, telehealth itself will have a huge impact in terms of how care is delivered, from prevention to palliative care.
That's right. They're concrete changes
setting.
This time. The last time we tried to really prepare for pandemics was after 9/11. And there was major legislation that captured bioterrorism and pandemic preparedness, but it wasn't after a pandemic. So while there were hospital plans, I'm sure a lot of folks I'm talking to know about this. There was a lot of money that was put into state planning and that kind of thing. We were trying to envision a future that we hadn't experienced. So this is different. There are ways that we will not go back. I can't imagine, and we'll play a role. The Agency for Healthcare Research and Quality will play a role in knowing where respirators are, knowing where the equipment is, stockpiling PPE and that kind of thing, because we've been there, and so that's for sure.
Well, coming back to what you just said about a lot of money was poured into the system, and going back to your focus in the area of research, R&D, a lot of investments have been made over the last 5 years, 10 years in the biomedical sector. And as a result, we have produced a phenomenal amount of innovations, and that has put US as a leader nation in the world when it comes to biomedical research. But at the same time, when it comes to delivery of care, we have really lagged behind significantly.
Yes.
Tell me what's happening. What have you seen in terms of
right
and what's driving it?
I'd say that the lag is not just in history. The lag has happened this year with COVID. For example, had somebody called up the Agency for Healthcare Research and Quality and said, we need a vaccine distribution system because in January of 21, we're going to need to have a vaccine if we possibly can. That should have happened in March. I mean, that should have happened in late February, right? Health services research should have been, and in many ways has, but not enough, an equal first responder with biomedical R&D. And I think one of the problems that we have in our policy environment is that we undervalue and underappreciate health services research at loss of lives, loss of time, loss of health. I think it's really one of the biggest blind spots in our health policy currently.
So Ellie, explain to me, for years I've read, and you have all read, that almost 1/3 of the entire spend in healthcare is waste and duplication and even abuse to some extent. And some people have said in excess of $1 trillion. Dr. Peter Pronovost at Research America a couple of months back pointed that out. He said there's a $1 trillion problem. That's a care delivery problem.
Yes.
Given such enormity of waste that's happening and the possibilities and opportunities to recover some, help reduce that, so it can help the bottom line, reduce the cost, and improve value, why that has not struck the interest of, say, policymakers? What's the stumbling block?
It's harder to humanize it. And that's why, the Agency for Healthcare Research and Quality is so associated with reducing medical errors, because you can humanize that. You can, if you haven't had a family member affected, you can imagine it happening to you.
Mm-hmm.
But when it's things like the other kind of waste and duplication of services or variation across the country in the number of something, C-sections or something, it's harder to go into a congressman's office or a congresswoman's office and relate that the same way as it is you go in and you say, my son is 9 and has cancer. We need faster medical progress. That's an easier one to really get a feel for. But they're both, it's possible. It's just that you have to connect it to the people. Some of the problems in our system have to do with if the healthcare errors, right? If you think about sepsis and sepsis rates, you can humanize that very easily. And ARC has a role to play in bringing those rates down. So there's a path. It's just that it's easier with medical progress to talk about.
Coming back to congressional interest, 5 years back, Representatives DeGette and Upton had great interest in healthcare, and they thought about what is now known as 21st century cures. And huge investments were made, and as a result, we as a nation are better off. It was refreshing to read their open letter way back last year, I think in November timeframe, when they were talking about Cures 2.0. And in that open letter, I recall reading that they are moving and shifting the interest towards delivery of care as well. So a little bit more about what's happening on the Hill, what are thinking. Now, of course, I spoke to them last month as well, but I'm curious as to what you are hearing from them.
Sure. My great hope is that shifting towards more health services research because of your team, in large measure, because they're pounding the pavement and making the case. What the original vision, unfortunately, in my mind, was when they were talking delivery, they were really only talking coverage policy. They weren't talking about health services research. But, I've been there, Boyce has been there, Sam's been there. We are on the Hill making the case that the delivery system is the way you draw value from medical research. Medical research on its own is research until the patients receive it in the right setting at the right time from the right people. That's where the value comes in. And so it's crucial to have a greater emphasis on that. And so we've been talking to Mrs. DeGette and Congressman Upton's staff about that very thing and making sure that Cures 2.0 really elevates health services research and the funding devoted to it. By hook or by crook, we need more funding.
Yes, actually, and I mentioned that to Representative Upton and DeGette during my conversation a month back or so, that the way I'm envisioning Cures 2.0 is really 21st century care, because we already have 21st century cures. And you've heard me say this, that cure and care are two sides of the same coin.
That's exactly right.
Just not focus on new discovery, but while we're coming up with new discoveries, we still want to have safe and high quality delivery of care as well.
Absolutely. In every part of the country, for every population. And, it's so important to health equity. It's so important to health equity, not only racial, ethnic, but urban, rural. You guys hold a key, and Congress is refusing to grab that key and unlock the door. So we're just pushing them.
Yeah, but coming back to equity and priority populations, now there is a huge caucus, right? There's a rural caucus. There's also a Black caucus, and there are Hispanic caucus. They all have interest in that. Where are they coming from? I'm just curious as to what's their thinking, because in one of the things that we need to do at ARC, as you said, have a better story, but we need to synchronize it with what's the thinking going on. So I'm curious as to what kind of thought processes you're hearing from.
Well, I'd say there's no question that there's heightened interest in addressing the social determinants of care. And again, that's where health services research comes into play, right? No question. And I think one of the keys to that is that individuals who are in those communities have to be calling the shots more so than they are today. And that's where those caucuses come in. And they're taking more of, I think, more than ever, a leadership role where they're saying enough is enough. We've watched what happened with COVID-19. We're not going to sit back and keep watching the discussion going on about social determinants. We're going to figure out concrete ways to get at this problem. Mm-hmm. And I do feel that health services research's name written all over it, because the worst thing that could happen would be to throw solutions that have not been tested, where there's no basis for them, at a problem. All you're doing is throwing dust in the wind. So you need the research.
Now, one of the areas where ARC's focus has been, but not enough, and we need to really rethink, is primary care. This the use and effective use of primary care particularly in a situation where telehealth is happening and the connectivity issues are there, and then we want to move towards prevention rather than in hospital care or special care. We want our people, the country, to be healthier and better and smarter about their well-being. Where are you seeing, is there a dialogue and conversation or interest on the part of on the Hill?
I think things have evolved a long way, probably more than I would ever expected, because, to be honest, there's so much conflict between the specialties and primary care for the specialties to hold on to their piece of the puzzle. It's natural, right? Mm-hmm. The more responsibility you give to primary care, the less referrals there are. That's not going to be good for other segments of the provider base, right? But we're still seeing a greater emphasis on primary care in this country. And I do agree with you, telemedicine will heighten that, if anything. But there's, I'm not denying at all the need for specialty care, but we do know that compared to other countries, we rely less on primary care, and our health outcomes are not good as other countries, even though we spend a lot more money. So again, that's another place where you all are so important, because you can figure out what's going on here, and it won't have an agenda. It'll just be what you see and what you analyze. So you can help with this movement to what's the right amount of primary care versus specialty and other.
Yeah, and of course, there's a huge amount of research agenda, and I think you and I once talked about the fact that we always think in terms of research associated with NIH and FDA and CDC, which is extremely important. They have a science and research, and obviously NIH for cures and FDA for drug efficacy and CDC for public health. But there's a huge amount of science and research agenda for delivery of care, making it better, more efficient, effective, and safe. Somehow, absolutely, that research agenda gets lost. Why is that? Because
I don't really, I was thinking about this, having been kicking around the hill for 3 or 4 million years at this point. I would say that probably one of the most influential pieces of research that has affected federal policy, Medicare and Medicaid, CHIP, ACA, so health policy has not been biomedical. It was the RAND health insurance study. It was a piece of health services research. had concrete impact. You would hear policymakers talking about and debating the results of that research, which had to do with the effect of coinsurance on behavior of patients and quality and that kind of thing. But it was hugely influential in shaping our major healthcare programs and changes in those programs over time. So again, I think that there has been there's special interest in biomedical research that health services research doesn't enjoy. So that might be one factor.
But coming back to the example that you just pointed out, can you envision there are other areas where we can have that kind of our kind of research, systems research can have a huge impact, a transformational impact?
Yeah.
What could
I'd say there's one
areas?
right ahead of us now. If you think about Never Again, the Never Again Commission that the first Never Again Commission legislation came out in March. So we still don't have a bipartisan commission of external experts in place to look at COVID, figure out the lessons learned, figure out what not to do again, what to do again, what needs to happen. I'm hopeful that's going to be in place either by executive order or one of the pieces of legislation will pass in January. It should have happened before. If I was going to staff that commission, I'd say the first thing we need are what are the top 10 questions we need answered? And 8 of those questions are going to be health services research. How did the system respond? What was the biggest mistake we made? What did we do right? Who did it and why them? Those are operational questions. Those are not biomedical questions. So that's you guys. Your seat at the table would be 3 seats at the table, and no one gets 3 seats at any table.
Well, I guess we're talking more about that. You're absolutely right, and we need to play a leadership role over there.
Oh, absolutely.
To the industry, is there are we not connecting the dots between investments, say, in the pharma industry, in the biomedical industry? They come up with new drugs and new cures, and at the same time, we find that that people may not be using those cures effectively. I think we talked about the example of statins. 50% of the people don't even fill the first prescription, and
right,
and then there are 25% more that may not even
that's right
prescription. So in other words, there's not enough utilization of where good research is available. So does pharma industry see the value of health services research, or they don't?
Oh, I'm sure that they do, but where you're really seeing it, which I think is really exciting, is in the Verily's, the Alphabets, the companies that are trying to transform the healthcare system to improve health, eliminate these the waste, to save money and that kind of thing. They're relying on health services research. And it's things like that. It's medication adherence at the level of these chronic diseases. Mm-hmm. And Verily's vision is to ensure a community and provide them kind of old model managed care, which is, you pay a fee to a doc for a year, and then they are held to standards of how much medication adherence there is and things like that. So you're definitely seeing interest there. In terms of pharma, they should be using health services researchers to do things like figure out how value-based reimbursement should work, and defining value by talking to patients and that kind of thing. That's not something a lab, a bench scientist is going to be doing. Mm-hmm.
So like Research America reaches out to all of these industry groups, and you have an enormous amount of engagement on the part of the industry at large. So let me shift gears and ask you a question. Why wouldn't the insurance industry have similar interests, because if healthcare research can help improve the lives of the patients and their well-being and their wellness, why wouldn't the insurance industry, or is there I'm trying to connect the dots.
Sure. And, Research America, we do have industry, we have the whole ecosystem. So we have a small insurance represented in our base. Mostly we have universities and patient groups, but we also have pharma industry. I think the health insurance industry does leverage health services research, probably not enough, but they do community studies, and they do some research for medication adherence and medication management and that kind of thing. But I agree with you. You would think they'd do more. And Kaiser's, I think, getting more and more involved over time. I bet your audience knows a lot more about this than I do, but it's a very good point.
Somehow, for me, it appears the gap is very large. So even if there is interest, the question is, how big is the gap, the need to do that research and create value for them?
I think that's right. I think part of what ARC does is a lot of what you do is kind of a public good. So industry is not going to pick it up, but that's why our tax dollars are well spent on you all. So
and that's what actually, you're right. And that's where I was trying to thank you for saying that, because it's always about, for ARC, is the larger common good.
That's right.
That's what the taxpayers should support us, because of that larger good. So
you fund the kind of research that'll determine how long a preemie needs to be on a certain type of nutritional formula or something. You do things that, you save lives.
Yeah. So shifting gears now, we are seeing a lot of infusion of new technologies, and the gizmos that you wear, the connected devices, producing more and more data and information. And that's a new domain where we do not know what works. We do not know what does not work.
That's right.
Safe. Do you see an emergence of a new area of digital health research? We established earlier this year, as you're well aware, a new division within ARC, Division of Health Research, and it's all about digital health research, focus in that area. And I was wondering what you're hearing from amongst your constituency of people that you deal with on the digital side.
Oh, absolutely. I think it's not only going to be important from a healthcare standpoint, like can we use digital devices to help inform care, or are they reliable enough? That kind of thing. But it's also security. There's a growing concern about the ability to influence this equipment, to do harm. You've heard these, they seem like scary, weird movies that you never would see in real life, but where hospitals are infiltrated and pacemakers are, those kind of things, you're hearing more about that on the Hill. A version of cybersecurity, right? So digital security.
So tell me a little bit about working with the folks on the Hill, your art and science of communication and humanizing, because that's your area of big expertise. You know everything about the healthcare business, but tell us a little bit more what you, in your experience, you've seen grab the attention of the people on the Hill. Because one of the responsibilities we have, and my colleagues like Boyce and Sam and others are doing a terrific job in terms of relating to what the needs are. But
they are, but the truth is, you can't, in a role like Boyce has, you cannot get to every health legislative assistant and be a resource for everyone. Whereas those of you on staff who really know health services research, if you were to get in touch with the Health LA in your, let's say you're originally from Minnesota, so one of the members, and just offer to listen, if you get any constituent mail that has to do with medical errors, you know, I'd be glad to help you figure out an answer that makes sense. The key for me when I was on the Hill as a legislative director and in advocacy where I'm on the other side, it's just relationship building. It's just talking to people that you think you're gonna like, and you turn out to make a friend and then be able to be of assistance. That's the easiest path to conveying a message as important as this one, which is that health services research has an incredible role to play in the future health of this country.
So that requires a huge cultural shift for an organization like ours. We are a science and research organization. Our focus very much in using science and research for best solutions, tools, best practices. In your experience, since you work with different organizations, how have they recalibrated themselves to re-message? Because it is not simply a person like a Boyson or Sam or others can do it. It's a collective effort.
It is. And I think folks have to decide for themselves whether they want to have a role in which they are involved in influencing federal policy, and but it's every citizen's right to do so. And it's not as hard as it seems to do so. You know, it is true that the 1,000th letter that a member gets, you know, may or may not have any effect. But even letters to Congress, typically, at least in Sherrod's office, I work for Sherrod Brown, he knew that most of the letters we got that week were on this topic, what that topic was, what the policy options were around it. So he knew what his constituents were writing in about. But more effective would be an email again to the health legislative assistant or the legislative director saying, hey, let me help. Let me be a resource. Folks are talking about making a change to CHIP. If you want information on the available research that shows what that actually will do to people, I'll shoot you this article. That's where you form a friendship where then what happens, or a relationship, but then what happens is a week later, there's a constituent piece of mail about some other issue, and they call you because you're a health person. They don't know what kind of health person, maybe. They don't exactly understand health services research, but you've offered to help them, and they reach out to you for help. And then that's how the conversation starts, where you become an advisor. And I really relied on people like that when I was a legislative director on the Hill. It's just folks, you know?
You're absolutely right. And again, one of the things, the responsibilities that we have at the agency, I have and others, is to constantly educate and inform the Hill. And we take that responsibility very seriously. But again, it's important for us to be in tune with what the interests are as well on the Hill.
Yes.
Where
yes.
Hearing from folks like you is extremely important, because we get a sense of you're there more often than we are. So it always helps us to get your viewpoint. So having said that, coming back to Upton and Daggett, how do you see that conversation going? Obviously, they've been at it for a year now, but with COVID-19, everything has been dislodged and the whole timeline has changed. What do you see will be happening in terms of dialogue and conversation with Upton and Daggett on the Cures 2.0 or ours 21st century care?
Right. Yes. I actually think this is a moment of opportunity. Congressman Daggett, Woman Daggett, and Congressman Upton are both, they're kind of a rare breed in that they worked so hard for the first 21st Century Cures Act. You know, they were pounding the pavements themselves, talking to people, getting ideas, pushing this bill. You know, that bill had 9 lives. It kept dying and dying and dying, and they would revive it. And I think what they want this time is just another piece of legislation that makes real change. And any good idea is an idea they're going to listen to, but it has to get to them. And that's the trick. So let's say and I think creativity is not just for people who've been kicking around the hill. Let's say anybody in this audience thinks to themselves, one thing I noticed with COVID is that what happened to this population if they, their cell phone doesn't work, but they need care. What did they do during COVID? I've got an idea. That can be something that is fed for a bill like this, a policy change that requires providers to provide this kind of email access for people who can't use whatever it is. That can actually influence change. Get that idea to me if you don't feel like talking to the hill themselves. And you and I will talk about it. So I think there's opportunity with that bill for new ideas that have to do with COVID response and specifically.
So Ellie, do you think the Cures 2.0 and or 21st Century Cares part of it will get more wrapped around COVID-19?
I do. I do think that it's going to be hard to pivot. I think that there will be some pieces of that legislation that have to do with PDUFA. If you don't know what PDUFA is, more power to you, but it's a user fee bill that has to do with FDA. So there will be a number of the FDA provisions in there for sure. But I think there is opportunity for them to be COVID-related health services research projects, challenges, that kind of thing. Pretty applied. Well, and one of the things that's great about health services research is it's really applied research. Even if it's an investigator curiosity driven, it's applied. It's going after a goal that really appeals to policymakers. So, but I do think it's going to be COVID oriented. My guess is.
No, one thing we have noticed during this COVID-19 crisis has been, even from the department's perspective, they're looking for more rapid cycle research. They're looking for evidence that can be synthesized and brought much faster. We cannot wait for 5 years to learn what can work better. We need to have a much faster mechanism beyond investigator-initiated research.
Right.
So my colleagues here at ARC are recalibrating and rethinking, and we've been able to provide answers in 2 to 4 months, 6 months timeline, as opposed to 5 years and 6 years. So I see change happening as well.
I think that's wonderful. I think the best way to sell longer term research projects, the health services research projects that are longer term, is to couple them with some shorter term ideas. So you're getting at that feeling and that need for urgency. And it's an advantage health services research has over biomedical research, is you really can turn some work around faster. But then don't lose sight of the longer term either.
Exactly. It's not this or that. It's all above. Right.
Yeah, but it's very exciting that the work that health services researchers can do to make sure we are not here again. And in fact, we're stronger going forward.
How engaged is your board of directors at Research America? Tell me a little bit more, for the benefit of our colleagues, a little bit more about Research America.
Sure. So our board, our board is, we are so fortunate. Our board is very engaged, and they represent the Research America ecosystem. Again, we have universities, scientific societies, patient organizations, we have philanthropies, and we have industry, and we have independent research institutes, and we have academic health centers. I always forget a couple in there. And our board looks like that. So we have health economics researcher. We have Mark McClellan, Dr. Mark McClellan. We have Ellie Dehoney, who's former NIH director. We have Nancy Brown, who's the head of the American Heart Association. We have Keith Yamamoto, who has 10 different titles at UCSF. You know, we have several board members like that. We have the head of the American Association for the Advancement of Science, Sudip Parikh. We're just blessed, and I hate to leave anybody out. And so they're very, very engaged. And one of the things they're thinking about very much so is how to elevate the whole R&D ecosystem. In the, if you think about the national defense, research, health services research, biomedical research is also the national defense. So
Yes.
how do we take this moment where COVID has made that so clear and
Yes.
elevate the priority? But I bet, Jamie, this means we're probably running out of time because I see.
No, I mean, I have some questions that are coming in, so I wanted to we get the opportunity to ask those. And actually, you're hitting on a really good point, and it relates to one of these questions. But we at ARC are always thinking about kind of new partners for us. Obviously, given our size, partners are always important, and Research America is obviously even a partner of ours. But we'd be curious to hear your thoughts about if there's other partners we should be thinking about, especially given the changes that are happening in the healthcare system, or ones that you might think we might not have engaged in the past.
Oh, yeah, no, I mean, I absolutely think that a theme that is going nowhere is public-private partnerships. And I think that makes a lot of sense, right? You bring in the whole system to get to whatever the goal is that you're after. So I'd love to see the agency play even more lead role bringing other agencies in and private sector to get at some of these problems. I think Verily would be, because Rob Califf, who's a former FDA commissioner, is I think he would embrace the notion of working with the agency to look at community health in different ways and to bring in the health services researchers' perspective, even more so than he's already doing via the agency. So yeah, I don't know how you all feel in the audience, but for me, this has been a huge theme of COVID is, stop sitting in the silo. I hate the word silo, pardon me for using it, so overused. It's like curate, that's another word that's overused. Anyway, but get together and get it done. Like, don't stop caring about who you are and get to the end, across the finish line.
Yeah. Jamie, do you have more questions from the ARC?
Yeah. There's two others. So this one is a little bit more specific. I think you mentioned that in response to COVID-19, like a number of HSR questions would need to be answered. And you made a reference saying that you saw it coming out of an executive order, but I wondered if you can talk more about that. Why do you think it would come out of an executive order, or do you think it's something that could be part of a new COVID package if it was ever passed, or any of that?
Yeah, either way, really. I do think that the president, whoever the president may be in January, because I don't think it would happen probably until lame duck's over. I said new, I meant whoever the president would be in January, has the authority under an executive order to establish commissions like this. And of course, that's a lot faster than a Senate going through the House, going through the Senate, getting signed into law and going through the, getting signed by the president. But you're right, it could easily get dropped into the next stimulus package that we have after the new year. I don't think, even if we have a stimulus in lame duck, I don't know that we'll see something like this stood up, because you have to figure out who's going to be on such a commission. Every bill has a different look to it in terms of what this commission would look like. It's a shame. There's a great op-ed from March saying, where is your commission? It was by one of the people who worked on the 9/11 commission. He was one of the, he may have been the lead. It's like, where's the commission we need? And now here we are, in October.
So there's one other question that has come in, and this one is, you've had lots of experience both working as a staffer and communicating with staffers. Which strategies have you found most effective for gaining their interest, and how could we at ARC rethink some of the ways that we discuss complex health services research? Are there better ways that we can do that?
Wow. Let me think about that for 2 months and I will get, that's a great question. That's a great question. I really think that there are two keys, and one is just simple. And I'm an over-explainer from the day I was born. If I could say something in 3 hours that I could say in 5 minutes, I will use it 3 hours. But it's very true that you can just say, listen, we don't know X. The only way to find that out is to do the research. I promise you it's not going to take forever. All we need to know is why and it's going to help these people because that's it. You always link it back to people, even if this is going to strengthen the hospital system and you happen to have 15 hospitals in your district. It's really good to have district or state information.
Mm-hmm.
You know, the Alzheimer's, there are 5 million people with Alzheimer's. That's equivalent to the population of Iowa and New Hampshire combined. You know, you get the picture? This health services research is going to figure out where the biggest concentration is and whether the hospital capacity and the daycare capacity is sufficient. If we don't know that, what's happening to the patients? That's the kind of messaging that works on the Hill.
Thank you. Very helpful. I think that's it for the questions that I've received. Go, Paul.
Ellie, let me go back to the Cures 2.0, the discussion about 21st century cures and 21st century cares.
Yeah.
Now, extremely involved with the 21st century cures discussion over the last 5 years. And of course, a mental picture evolved as to what that means. When you think about 21st century care that we talk about from the delivery of care perspective, what kind of images come to your mind? How would one, if Upton and Deget were to say to you that, Ellie, give me a view and vision of 21st century care, what would that look like from your vantage point?
Oh, golly, I'm going to bring such a bias.
So go ahead, that's all right. No good answers, no bad answers.
I think that, you know, it's because I'm living through it, but I think that one area that we need to confront is end of life care and palliative care. And I think that COVID raises that issue, brings that issue to the fore also. And we need a lot more research to understand what actually is happening, what the burden is on caregivers, how to make for more systemic decision-making in that arena. So I think that would be a facet of any 21st century cares bill. And then I also think that telemedicine and technologies would be a big piece of it too.
Mm-hmm.
But first, I would triple or quadruple or more. I don't even know what the next one is. The size of ARC.
Well, yeah, that aside, of course, that will always be welcome, but that aside, so those two make sense. There needs to be more focus on the palliative care part of end of life, as well as telehealth, digital tools, technologies, and what that means. What about moving towards precision care? Because we've always, when it comes to care delivery, and ARC's research agenda has been very much clinically focused research agendas. We talk about social determinants and whole person care. Do you see in the 21st century care vision, do you see that as a component, bringing it the social determinants piece? For a more,
you know, I've got to be honest, is that you all have a great role to play in breaking down that terminology into what's doable when. You know, I hear social determinants and I hear societal change, and it's very intimidating.
Yeah.
And so I do think that it's going to be it's going to be at least part of the policy discussion. But it's very hard to figure out legislation that can deal with things like housing and food deserts and that impact on health. I think an agenda that says these are the immediate deliverables that we can do. This is the research needed to get there. These are mid, you know, time-wise, they're in the middle, and then longer term would be such a wonderful thing. And that could be a piece of legislation that passes Congress. But I don't think that's going to be 21st century cures 2.0 or cares, whatever it ends up being.
And what about the data and analytics part of it? There's enormous amount of new data coming in that's for better care of the person, patient-driven data.
No question. Data science is going to be a big theme.
Do you think that
scares
would be a big...
the bejeebers out of me because I can't even talk about it without getting nervous. But yeah, but I think it's, yeah, It's definitely going to be a huge theme. That crosses over between health services research and biomedical research. It's transforming both, right?
That's a good way to see it. Jamie, any other questions that you have? I just want to keep an eye and be respectful for our colleagues who may have additional questions.
Oh, you guys must be bored to death. We've been talking forever.
No. I think that's it. And it's okay to, given that we have a 12:35, we can give folks a little bit of a break if once you've completed, it's totally fine.
So, thank you.
I hear a song that folks at the agency put together.
We have a very, very talented group of colleagues who, when there's special occasions, they write a song and perform it.
That is so cool.
It is very cool. And so they've written a special one, which we're all excited to hear.
Oh my God, that is awesome. I always threaten that I'm going to rap whenever I'm on a Zoom call and people get scared.
Well, we should have planned for that. Do we need another one?
Jamie will be singing and dancing, by the way. So you wait for.
Love
it. Well, Ellie, this has been a delightful conversation.
Oh, it's been such a pleasure. I don't know if you guys can tell that I'm a huge fan of all of you, whoever's listening in. It might be kind of apparent.
Thank you so much. Thank you so very much.
Okay, absolutely. Thank you. Have fun.
Thank
Bye.
you. Take care.
Thank you. Bye.